Hey guys, come let's talk about testosterone therapy. Everybody is saying, what is testosterone therapy? Who gets testosterone therapy? There is primary hypogonadism and there is secondary hypogonadism. Secondary is usually there's something wrong with the pituitary gland, or you had an injury to your testes, the way you ride bikes and sometimes fall, or something else is wrong with the testes, so you get on testosterone therapy. And then we do have the guys that get on testosterone therapy that their levels are low. Normal levels in most cases are 300 and above. Some guys with age, these levels go down. And when they do go down, it causes fatigue, other symptoms. You want to exercise, you can't exercise, you're tired. Then they do have their levels checked and they notice that the testosterone is low. Sometimes you have to request it. Sometimes a doctor will check it if you do say, or tell them what your symptoms are. So when the levels are low, you are able to get exogenous testosterone. Exogenous meaning it's not made by the body. You have to give it externally via cream, patch, injection, whatever method you as the patient prefer. If you're male, I'm talking about testosterone for male patients in this video. If you're male, so you talk to your doctor, they do the tests. If it is low, and you want it replaced, so to feel a little bit more energetic, back to energy, not having decreased libido, because low testosterone will cause decreased libido, especially in older men. So if you need some help, you can get the exogenous testosterone and replaced, but you have to be monitored. Your levels have to be monitored. Exogenous testosterone does have side effects. So the reason you get it from a place that is credible, they will monitor your labs. They'll monitor signs and symptoms that you have, and they will monitor side effects of the medication. As you all know, medications do have side effects. So you want to follow somebody that is monitoring your labs every so often, especially if you are on exogenous testosterone. You want your labs monitored, not necessarily just being on testosterone, but you do want your labs monitored. So did the testosterone get to a good level? You don't want even to go above 1100. Some people do go above 1100, but most patients will do good from anywhere between 400 to 1100. So you have your labs monitored, you start the testosterone therapy. Usually for most people, it's anywhere, different clinics, different ranges. But for most people will want to monitor your levels 6 to 8 weeks or between 8 and 12 weeks, especially when you're still starting, just to see where you are. It's important you get monitored. Even if you're feeling good, everything needs to be monitored, because what happens with testosterone therapy in some patients, it does cause side effects. And your blood level, you do have a hemoglobin and hematocrit. In most cases, the hematocrit goes up, and you don't want to go to too high a level, such as 58, because then you'll start getting symptoms of what we call erythrocytosis, which is elevated hematocrit. It can cause shortness of breath, even though you're walking on a flat surface. That's the reason we insist, if you're on testosterone, have your levels monitored. So these side effects are monitored by somebody. Don't buy it off the internet because you don't have anybody to monitor, or because of other causes of you deciding to buy it there. Get a reputable clinic, have your levels monitored, have your lab work drawn prior to starting. Occasionally they can go by signs and symptoms, but you do want to have a baseline of your levels to know, okay, do I need to be on therapy? And if so, how long do I need to be? If I'm feeling good, do I need to stay on therapy? Those are all the questions that you ask. So a lot of people will get it for exercise, but the truth of the matter is not FDA approved for that. It's the muscular, the gaining the muscles and stuff. It's not FDA approved. The main FDA approval for testosterone therapy replacement is hypogonadism, meaning in men the testosterone level is less than 300. You have the secondary one that you come from injuries to the testes, pituitary gland, and other causes that cause the secondary one. But initial primary is hypogonadism in male having low levels of testosterone. So discuss with your doctor, see if they can write you a prescription, but monitor your levels. How can it be administered? There are many ways of administering. My computer keeps going off. There are many ways of administering testosterone. You can get it via injectable testosterone. You can get it via tablets that you put in your cheek called buccal tablets, transdermal patches, and cream. Cream is tricky because if you do have somebody that you're close to, like a spouse and stuff, when the cream goes to them, they also will get the effects of it. There are people who love the cream. It works better for them. Price-wise, it's friendly. And they can use cream, but people don't like it because externally it can rub onto somebody else and they get the same side effects as you, even though it is you who's on the testosterone and not your spouse or girlfriend that's staying with you in the house. So most people don't like injectable, but you can do 1 to 2 injections a week for testosterone therapy. The lifetime for it is 7 days. So some people will do once a week and it works amazing. Another different patient will come tell you, I got it, but towards the end of the week, I'm kind of getting the fatigue and everything. In those patients, it's okay to break the dosage into 2 intramuscular injections a week. It is okay depending on what the dose is. Like every medication, start slow and titrate as needed. Titrate as per patient tolerance, as per your lab levels, and have your labs monitored. That way, if there's a side effect, then you have somebody you're following. They can tell you what it is. The importance of getting it is improved libido, sexual function, mood, muscle mass, and bone density. Now, there are some contraindications to people who can't get testosterone therapy, as per the Endocrine Society of America. If you have cardiovascular disease and you're followed by a cardiologist, make sure that the cardiologist approves you for it. If the cardiologist is okay with it and gives a note and says he's okay, he can take this, that's okay. But if you have cardiovascular issues and you're not followed by a cardiologist, you don't want to be on the medication because it increases other side effects that you don't want to happen to you. Blood clot, history of blood clot. If you have an elevated prostate-specific antigen, which in most people say PSA. In older male, that's a test that's usually done because it gives you a baseline of risk factor for prostate cancer. So if you do have that, make sure you are followed by endocrinology if you're elevated PSA. They may not allow you, most endocrinologists will not allow you to be on testosterone with an elevated PSA level, because that will increase risk for prostate cancer. You don't want that. If the level is already elevated, other people who shouldn't be on it is if you have pituitary tumor. Pituitary tumor, those are your baseline labs prior to starting testosterone. If that level is high, then you don't want to be on testosterone. You will be sent over to an endocrinologist, and the endocrinologist will take care of you from there, but you don't want to be on testosterone. Those are the main basics, if I can think of anything else, but mainly have a clinic that follows up, does your baseline lab work, and does lab work thereafter to monitor. Monitor your levels, because your hematocrit will go high. Besides monitoring your levels, you're being monitored for side effects, and beside side effects, you want to monitor the hematocrit to make sure that it's not elevated, because it will give you side effects. Any questions, follow up. Remember, I'm a nurse practitioner, but I'm not your nurse practitioner. So follow up with your primary care. If you need any questions, come to R&R. We are located in Aurora.